So in this video, we're going to be talking about the difference between a lunge and a squat, or a squat and a lunge. So in a squat, we're going to be primarily loading into the gluteus maximus, gluteal muscles. So then we're going to be focusing on vertical based motion. So imagine sitting into a chair like this. So we're going to be flexing or bending the hips, knees, and ankles, all three. Okay? But most of the load, you imagine taking it and pushing it back and then sitting into your hips, which means you're going to be hinging the hips and then sitting into the hips. Now you're likely to feel some of this in the knees because you're bending the knees, but you want to try to imagine, and you can always use a table or wall or something to kind of safely offload your knees and keep your weight forward. You still want to plug in through your feet, those tripods, heels, pinky toe knuckles, big toe knuckles, but when you connect to your glutes, you want to push back, sink into those gluteal muscles, stretch those glutes, load in those glutes, and connect to. If we were to do a split squat, we're going to be in a, what might be called sometimes as a lunge position, but we're not doing any lunging motion. Instead, we're bending the back knee with the front knee, and we're lifting the chest perhaps a little bit as we lower down. So if I had some buckets or dumbbells, I'm lowering them down like this, or I maybe pitch forward and lowering them down like this, but I want to definitely feel like I'm pushing my weight back into my hips, primarily the front leg hip. So I generally want my weight over my front foot. So pitch forward is probably optimal for this. You can be a little bit more upright here, so long as you kind of drop down towards your foot. So that's the squat version. The lunge version is more of a horizontal, okay? So that's where you're gonna actually be loading and focusing on shifting more from your ankle. So like I'm doing here, it's a rocking motion, imagine like a joystick. So it's more of an ankle strategy versus a hip strategy as you're doing this. So you're still gonna wanna load in the hip to put most of your load there to manage it. And you can use these in combination. And in fact, when you squat, you're gonna use a little bit of the lunge just to get your knee out of the way when you go down deep into a squat. So it's okay to do a hybrid, and oftentimes we do, but it's important to know the difference between the two. You wanna really be able to kind of control those elements and really recognize which muscles you use. The glute max, particularly in the hip aspect, hip hinge, and the squat part, and then the soleus in particular here in that lower portion of the calf and working into the ankle as we're working that more horizontal as we're rocking through. So in the lunge, you imagine like somebody, like a fencer here or here, that kind of a motion. We want to definitely be kind of lunging in a forward direction. So your knee, imagine like your kneecap coming forward. In a deeper lunge, your kneecap is most definitely going to be coming forward past your toes. And that's the position where a lot of people with knee issues are going to be a little hesitant or even fearful because perhaps in the past they've experienced pain in those positions. And that's where you want to actually work on loading that soleus muscle and retraining that muscle. So you want to be able to pull back, load your glute max first, ground that heel, and from there, lunge forward to load with the knee going out towards pinky toe, feel pressure there, but also get your weight forward to load the big toe knuckle so you can balance and control and shift your weight forward as you push into the toes more, toe knuckles, be able to adjust that and handle that weight and control that weight through that soleus so that you can train that muscle to manage the weight and lengthen itself and then shorten itself so you can rock forward and back and offload the quads in the bend, right? You can tighten the quads as you straighten it, but offload the quads in the bend so that you're not overloading, overstressing. Because if the quads are too tight, too forced, too loaded here, it's gonna pull the kneecap up. When we bend, we actually want the kneecap to go down away from the condyles here, the femur, because that compression of the tightness in the elevated position, it can cause grinding on the patellofemoral joint and arthritis and pain, and those are bad things. We want it to move nice and smooth down its pathway and we channel towards the knee towards the pinky toe, and ground and put a lot of that load and tension in the soleus, pressure in the toe knuckles, anchoring in the buttock and the heel. And that way you should be able to bypass that overloading of the knee and basically channel, almost like you're bouncing back and forth through the toes and offloading the knee, and train it. Go slow at first, maybe use a wall, and go slow and teach it. Pull back, seatbelt, load hip first. Get the hip hinge. Make sure you got good control there, because that's where most of your weight's gonna be. And then train that lunge through the ankle. Sorry, I can't see that very well, but there. And then you can do more advanced things, like actually lifting the heel, training it, like going upstairs kind of thing, and not overloading your knee, especially with a deeper bend like I'm doing right now. I'm on my toes, you can't see it, but on my toes, and I can bounce and do all kinds of things and not have knee pain, which is kind of nice. So good thing though, good skill to acquire and practice and master.